All right.
So I got to share, but I didn't get to save it, huh?
What? Oh,
It
you got to share it on your feed? Don't worry, I can get it from there.
did, but I get to save it. I'll find
See?
176 right up. So.
You clean it off after or you sleep it. Oh no, no, I clean my makeup off. I don't sleep with makeup at all.
Okay.
You sleep with makeup?
Yeah. Want to look at this good? Who have time to do this again? Not me. Alright, so let's do the lashes. Ooh.
It'll come through the face beat. Thank you, Liz.
Yeah. To get a nice girl. You shocked me.
Oh, they gas them up. I like it.
It was a pleasant surprise.
They want to know if your back hurting you.
No, 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 I good.
And
I'm
I
back.
learned from last week at doing a bold eyelash. Last time I struggled to put the eyelashes on and then it looked like my own.
But I have a kind of eye that is like this lash looks so crazy and dramatic, but when it go under my eye, you don't see it. So I just have to go real bold.
I want, hopefully this is crazy enough. I got a bigger one from last time, people, that I can't open. But the minute I open it, do you have a fast glue or something? How are you sticking that already?
Uh-huh. But girl, to be honest, all I could have found was the wave glue. And I don't use wave glue and I do not advise using wave glue. But tonight it gotta work.
So you're gonna have your lashes stuck on for like a week?
I don't find the wave glues last so long.
No?
Mm-mm. You see, it didn't make much of a difference.
Yes, you're definitely seeing it. Okay. Let me see if I improve from last week. I am one with the lash.
You know what
Hey,
helps?
hmm?
When you put the glue directly on your lid and then you stick it. Like brush it onto your lash line and then just stick it. Try that. Tarika,
I
you
pretty
know makeup on, right? Why are you asking like I don't know?
you're free to glue go in your eye when you do that.
And especially this eye, I have a little bump on my eye now. From this week it was hurting. So I should do that. I really should. Done!
Not done.
Well, they put on the lash line and
I
see.
did. Look at there.
I'm feeling myself. Not a little draggish, but that's okay. A little draggy. I'm going to apply some concealer.
Whoa.
It's another bit after, yes? For sure.
Yeah, that didn't work. Let me try this again. Part two.
Yeah, a little bit of sweet, but I'll be alright. Hold on, man. Do some finishing while you're doing on the lashes.
Oh yeah, I don't think I getting eyelashes today.
Oh gosh. Don't rub us. I don't even have a collarbone. So that's
Fail, fail, fail. Oh, yeah, my specialty is medicine.
It's a try.
I think the lash too big. SOS. Someone help me.
I would have helped you, but I ain't coming here.
Um, so I think I overdid it when I went for dramatic.
No, but it looked good. It looked really good.
Not really stuck on her. It just kind of hanging out there. Okay, let's see. As when I'm taking off my eyeshadow, half my eyeshadow, trying to put
Oh,
on a lash. Still not on. You see?
I think it's a finish spray today, no? But usually I would use like the Scandinavia, which one I use again? Ben Nye Final Shoe. This is me feeling myself, you know.
And this is me trying to get an eyelash on.
While you struggle, I have enough good time.
Okay, let me use some tools and see if this helps.
I'm looking like it on.
Whoa.
One side, I need to come the other side.
It fall off.
Uh-huh. In my chat.
I'm try holding it down.
What glue are you using?
Duo?
Hate your glue, you know, with Apache. They are better
What glue
glue.
you use?
Amazing Shine. If I using do it would be the black one, not that one. And the brush on one is actually better for me than that one. Hi,
So after
Crystal.
a full workout, I'm not gonna interfere with it because I don't think it really on properly.
Maybe that's just too long. Like the
Oh
length.
yeah, somebody's saying that. Cut it in half.
Okay, it is what it is right now. You know. Let's do the questions. And
All
so,
right. So
which
this is as good as we get. How did I do, guys?
I think you did good. You did great.
Thank you. I'm definitely going to recreate this on Sunday though. Once I wake up early, because if I didn't then definitely not.
You don't have any kids to keep you up or to make you run late, so
No, I have
you know.
myself for that. I like to like get up early. I always wake up early, but then I delay and I stay on my bed and I don't get out of bed in time. So by the time I get out of bed and have a shower and get dressed, it's like, oh my goodness, I was up, for the past hour and now doing this. So yeah,
You know
that's what happened.
it is. I can't sit down in my bed and no, that doesn't happen when you have kids.
Oh,
So,
that's true. So, um, thank you everybody for joining us for the makeup part. So now we're gonna talk a little bit about coronavirus and pregnancy. So Megan, as you know, she is pregnant. She is in her third trimester on her third baby. So we're just going to ask a couple questions about this, and then I'm just gonna give a little FAQs on coronavirus and pregnancy. Okay. So my first question, we kind of answered some of these before. You spoke about your prenatal visits not really being changed so much in Trinidad. You've had more or less similar. Do you do anything in particular to protect yourself right now from getting coronavirus?
Well, I try to stay indoors as much as possible. The only time I get out really is um to really go to my doctor's appointment, and maybe I'll do groceries, but generally I tend to stay indoors. And even if I do go outdoors, I wear my face mask and try to wash my hands often. And as soon as I come home, I would usually take off all my clothes, try to wash, and I would usually take a shower. Generally,
Right.
that is my routine when I do have to go outdoors.
When you go, do you have to take the kids with you or no?
No, I try not to. If they're with, they would go. I would drop them by my in-laws,
Okay, that's perfect.
but they don't go outdoors or come out the car to go anywhere.
Right.
Really not.
So, like you said, you're taking the right precautions because the precautions to take in pregnancy is more or less the same as precautions anyone will take. Try to maintain social distance as much as possible, wear a face mask or covering, um, stay 6 feet away from the other patient, at least 6 feet. I think it should actually be more, but at least 6 feet. As far as you can stay away from other people, that's the best thing. Wash and sanitize your hands as often as possible, and then when you come home, have a decontamination routine to like take off your clothes, put it in the laundry, have a shower, and start fresh once you're home. So that's good. COVID-19 right now, we're not too sure if and how it affects a pregnancy. We haven't gotten any data to suggest that it causes any harm to the fetus, which is good. But really, time will tell because we're evolving our knowledge as we gain knowledge about the virus. But so far, we haven't had any evidence of anyone having any birth defects or malformations of the development of the fetus because of this virus, and we pray and hope that it continues that way, that the virus doesn't cause any problems. We have had some people who had preterm delivery because of the virus, but we can't prove that it's the virus versus just having like a fever and infection. Any infection, any sick patient, sick pregnant patient could go into preterm labor, and that could be the case. So, it's a work in progress. We will see how that evolves.
Yeah,
Um,
my first pregnancy, there was the Zika scare,
oh,
and of course, you know what the effects on the fetus
right.
with
That has no effects.
microcephaly. Sounds like I went through that to the first one. The second one, I don't think they had anything going on at the time. Now Corona.
Right. So,
So
so far we haven't seen anything, and we hope that that is the case. My other question I was going to ask you is if you were deciding between a home and a hospital birth, and I know that you said hospital birth, and I advise the hospital being the safest place. They are taking precautions. They are, differentiating. In the US, we actually test in New York. I can't generalize in the US. New York, because we have such a high prevalence of corona, every single pregnant admission is tested for corona, and precautions are taken on every single patient as well, but everyone is tested for corona in New York. It's actually a state mandated
precaution.
test now. Yeah.
Wow.
So let's see what else I have. Um, I think we talked most of them from before, actually. I have like 7 questions and we kind of answer them throughout. So these are just other things that I wanted to mention about corona in pregnancy. So should you wear a mask? The answer is yes. We said that already. Ways in terms of like staying healthy. So Megan mentioned that because she's home a lot, that she's not really as active as before, and she's been eating, which I think all of us are. To be honest, the first few weeks of Corona, I was going to work like every day still before I started to doing some work at home. But I was going to work every day still, and I had my Corona snacks when I came home, and my my friends was like, "You're not even quarantined. Why do you have quarantine snacks?" And I'm like, "I don't know." So certain things we want to do and maintain is that you want to still eat healthy, especially during pregnancy, because you know that anything you eat is what essentially the baby's eating. Yep. And also staying physically active.
But my kids keep me busy because, I mean, having a
Good.
1-year-old, they are very busy. So, by extension, very active because of them.
Right. So Megan exercises running after the kids at one, and your daughter is how old?
But two should be three. Like,
The 1 and 2 is extremely active, but if you don't have a 1 and a 2-year-old to keep you active, you could do basic routines at home. And I mean, a lot of people are like having routines on Instagram. We're actually going to have a fitness coach on Friday at around 4 p.m. So you could join in for that as well. So staying active is very important during Corona. So a lot of people have concerns and questions if they're exposed to corona, if they think they've been exposed to corona, what to do. And the precautions, just like for the general public, would be, well, first and foremost, assess what symptoms you're having. If they're mild symptoms and you can take it, the first thing is to make contact with your doctor and explain this to them and let them guide you as to what to do. If your symptoms are extremely severe, you're having shortness of breath, you can't breathe at all, you have extreme sort of chest pain or anything that is a severe symptom, then you want to call the emergency department and try to get yourself to the nearest hospital as quick as possible. Do not stay home. I kind of touched on this yesterday. I talked with an an emergency room physician. Do not stay home if you are symptomatic, like extremely severely symptomatic. And it doesn't even have to be for corona, for anything. You feel like you're getting a heart attack, go to the hospital. You feel like the baby's coming out, go to the hospital. These things you need to go with.
yeah.
Yep. So I don't want you to feel, or any of the mothers on here feeling any sort of way. No, the hospitals are still open and they're doing all that they can to keep us all safe. And one thing I wanted to touch on that a lot of people don't really talk much about is that there's an increase in like depression, stress, and anxiety for a lot of people because they're staying home. A lot of people know that there's postpartum depression, but you could also be depressed during pregnancy. Or even if you're not pregnant, people, anybody could get depressed. And,
I've had moments where, I mean, especially like when the whole shutdown and lockdown and stuff started, um, I mean, I was in a really low place, not for too long, but
right,
every time somebody message and call, we have to cancel the wedding and we have to cancel our wedding and we don't know what day we're going to set. You know, there was a bit of uncertainty and, I mean, being pregnant, so your hormones already all over the place. It was a little bit daunting to have to go through, but slowly as things went by a little bit, I think for a week it was really tough, really
right,
hard. And somebody I'm very active. I love to work. I love being outdoors. I love meeting new people. I'm an extrovert, and being indoors really was getting to me. And I felt like I didn't even know if today was Saturday, Sunday. Every day just felt the same day, like I was just reliving the same day over and over and over. And it was a little bit depressing. But now, kind of getting used to it and looking at the brighter side of things. And baby coming along, and my life is going to change again. So just looking
right.
at the light at the end of the tunnel.
What were some of the resources you also looked at to help, like, family or friends?
In terms of,
Like trying to get out of that feeling of like, despair and not feeling 100% what you did besides looking more positive towards things.
well, I was just looking at the structure of my business and how I plan to change when things go back to normal. Um,
Right.
I would, touch base with people who I haven't called or messaged or talked to in a long time, and kind of, rekindle certain new friendships and because we live very busy lifestyles and we tend to lose contact with people. So getting into contact with people who I haven't spoken to in a long time, that helped. And just enjoying the time that I have with the kids home because they usually go to the daycare and they're growing so fast. And watching their development over the past couple months has been very um, amazing because it's things that I would have been missing and not
Right.
even aware of it. So I'm actually home more and I'm learning to enjoy being home more.
That's good. And I think a lot of it comes with adapting our baseline of what we think is normal because we're definitely going to have a new normal after this. Even if Corona was to
Yeah.
magically disappear tomorrow, it's never going to be the same.
No.
We're not going to go back to what we knew like a couple months ago.
I'm somebody, I hate to admit it, but it is very hard for me to adapt to change. Now, when I say it, like, if you tell me something to do now, I'll be like, no, I'm not accustomed to doing it like this. I want to do it like this. But I have to talk myself into it and be like, hey, change is inevitable. It's okay to change. Sometimes change is good. So
Right.
I'm learning, and this has taught me, okay, you cannot control everything. Things are not going to remain the same. You are
Right.
forced to change, and I'm learning to, you know, to adapt.
And that's good. Embrace the change. And I think a lot of people too are learning, especially people who own their own businesses like yourself, learning to how to adapt to like a new way of doing stuff, a new online module. Maybe you're gonna decide, you know what, I'm gonna start teaching online. I'm probably gonna give sessions online. Maybe I can't come and physically do your makeup, but I could watch you and guide you and give you tips as I see what you do with whatever you have, making it work. So I think a lot of it is just using the circumstances we have and adapting to it. I'm home more, and I was like, you know what? For the longest while, I wanted to make educational videos, educational content, and I just didn't have the time. I just didn't take the time. But now I have all the time. So hence these series that I'm putting on now because you adapt.
And for people who know me very closely and intimately, they know that I hate the kitchen. I would literally go in the kitchen, pick up something in the fridge, and walk right back out. I do not cook, bake, fry, nothing. Because I just feel like I do everything else that I don't need to be in the kitchen.
Right.
My husband's usually the one to cook and do stuff. But again, the time home, I was able to try new recipes and actually, I mean, do things in the kitchen that I've never done before. I mean, I kind of slowed down a little bit because, I mean, pregnancy is tiring.
I know.
So I slowed down a little bit, but I intend to pick it back up a little bit and try something else. I try salad roti, fry bake, and tomorrow to make fry bake in the morning. But
Oh, the
I'm more,
baker.
I'm a breakfast person. I'm not into making pie and callaloo chicken. No way.
Your starter roti came out well.
You want real good chicken? So,
I haven't adapted to that part of the quarantine. I'm more of a eater than a cook, so
I eat. I eat. And
I eat. Not into this cooking business at all.
cooking is too much work. Too much work. But I'm trying to slow down a little bit because, the weight gain is already way past what I expected. And in this pregnancy, I started off smaller than I did with my second pregnancy, and I'm actually gaining more weight.
Right.
So I know it's going to be a challenge trying to work out that weight. I mean, I did it before. I was successful, and I lost like 40 pounds the last pregnancy, after the last pregnancy. But now I have three kids, and I don't know when school's opening back, daycare's opening back, so it's going to
And
be a
then also
challenge.
you have to recover from your C-section.
That has nothing to do.
Okay.
Cover, Jeanette, I watching you eating too, eh? And you said I could do it. I usually recover very quickly because after my son, I started back the gym like 3 months after. I mean, doing life stuff, I wouldn't lift weights right away. My daughter, I didn't go gym, but I started working out like a month after. So I'm hoping on that with this one, I will be able to get back on my feet quickly.
Right.
But I know it's a C-section, and so
Right.
yeah.
And I just wanted to touch on for people who are trying to conceive, there have been a lot of questions, from people, should I get pregnant at this point in time? And to be honest, that's a very personal decision. We can't tell you yes or no. pregnancy has a lot of factors to it. And if someone is like actively trying to get pregnant and they had difficulties, so they, have experience in fertility, there's certain time frame we work with as women. So should I get pregnant or not? It depends on your age. How old are you? If you're 20 and you think you want to wait, okay, sure. If you're 40, 45, then you have to consider the time frame that you have to still be able to get pregnant. Any medical conditions you may have, because God forbid if you do get corona, it's going to be made worse if you have any other medical conditions like diabetes, high blood pressure. So asthma,
Lupus.
yeah. So if you have other comorbidities, you want to consider, is this the right time for me or not? And then it's how much at risk you are as a person. So you're working from home, you're not really leaving the house. Good. Your chance of getting corona is like greatly reduced. Or you're an essential worker and you're going to work every day, then your exposure is really high. And all these things you have to take into consideration, because remember that we don't know the real effect of corona. We wouldn't know the real effect of corona in a pregnancy until months afterwards, and we have enough people to study and see if there is an effect. And if there is an effect, what the effect is. So at this point in time, I think like if you're trying to get pregnant or you want to get pregnant, you should speak to your obstetrician and gynecologist and let them go through the different factors and come to a joint decision. But no one could really answer that question for you. Ultimately, you're the person who has to make that decision, but obviously your obstetrician and gynecologist could guide you on that. So,
I mean, I had my challenges with getting pregnant in the 80s, and well, now I don't have a challenge with getting
right.
pregnant. My just getting pregnant too often. So I was diagnosed with fibroids, and um, because of that, it was very challenging to get pregnant the first time. And
Right.
so then after that, it just happened too
Did you have to
quickly.
do surgery to remove it?
I didn't do anything to remove it; still very present, but I know that's one of the, it's very common amongst Black women,
Mm-hmm.
um, and it is a challenge, but God is good. Didn't
Okay.
have surgery, but some people, depending on where it is and the size and all that, it could cause infertility. So in my case, everybody's like, no, do the surgery, go get pregnant. No, do the. And I'm glad I didn't do the surgery and I got pregnant naturally
Right.
without too hard.
Megan?
Yeah, everybody's circumstances will be different.
Right. So with fibroids, it really depends on location. So I am going to use my beauty blender as a mimic of what a uterus looks like, because it really kind of look like an upside down teardrop. And you usually have your fallopian tube sticking out of it on the sides. Okay, I don't have a fallopian tube, but we have the uterus. So if your fibroid is located on the outside, the external surface of the uterus, which means that it's projecting inside the abdomen, then these fibroids cause the least risk in pregnancy because it's not really impacting on where the pregnancy will occur. Then there's the muscle of the uterus, okay? That's the actual body of the beauty blender. And if it's contained in the muscle, then it really depends on the size and the location. But the fibroids that causes the most problems are the fibroids that are inside the cavity itself, which obviously we can't see the cavity here, but inside the cavity, yes, submucosal is what you call them. So if your fibroid is located inside the uterine cavity, that's the hollow space where the baby should be growing inside. Those fibroids cause the most problems, and
Station and stuff.
yes, with implantation. So a lot of times people have fibroids. Sometimes they can still get pregnant. It's maintaining the pregnancy. And this is how I like to explain it. And it's a very simplistic explanation. Obviously, it's more complex than this. But I explain it like if imagine the lining of the uterus as if that's soil and the embryo is a seed. So the embryo goes into the soil and it wants to send out roots. That's like a placenta and the membranes, etc. Um, and if you have a fibroid, let's just say that you have a uterus and you have a fibroid right there, sometimes you still have that initial top layer of soil so the embryo could implant. But as it starts to go deeper down, the fibroid prevents it from really getting roots. So imagine if right below your topsoil you have like very hard clay, and it stops the roots right there in its tracks. Like you may be pregnant for a few days, few weeks, but maintaining the pregnancy becomes harder. And that's how the fibroid usually impacts on fertility. Some people wouldn't get pregnant at all when they have fibroids if it's located close to the fallopian tube and the embryo or the eggs can't get into the uterus itself. But most people, the problem is the implantation of the pregnancy. So in some cases, like Megan, probably the location of a fibroid, obviously, I shouldn't say probably, obviously the location of a fibroid did not cause any problems for her, but it's not a one size fit all, and it may not be the case for everyone. So, those are things you have to assess with your gynecologist to see if it would affect you or not, and, what would be the best management. Somebody
So now
says, what about,
someone who
sorry?
has no, so Jeanette was saying, what about someone who has no medical challenges and still isn't getting pregnant?
Well, infertility is defined as 1 year with regular unprotected sexual activity and you're not getting pregnant. So if you are infertile, and this means obviously you're not using condoms, you're not using birth control, no form of contraception. If this is happening to you, then you definitely want to see, I'm assuming you would have been working with your obstetrician and gynecologist before, so you definitely want to move on to a reproductive endocrinologist, an infertility specialist. In Trinidad, there is IVF Trinidad, is our only site in Trinidad. They have 3 locations. And I also know that there is one doctor who works with, I don't know what the Barbados clinic is called, but a clinic in Barbados. There's a doctor in Trinidad who works with a Barbados fertility. Sorry?
Prakash Prasad?
Prakash Prasad, yes, works with Barbados. So we have 2 possible sets of people that you can see that specializes specifically for infertility, because then you have to be worked up even further than the regular test that your GYN may be doing. If you are older, so the definition I give it 1 year is for 35 years and less. If you're older, 35, you're 35 to 40, then 6 months is the trial period before you want to go see an infertility specialist. And if you're over 40 years of age, then you can present anytime to an infertility specialist. You don't have to wait because, your fertility declines in women. The decline happens rapidly as we start to get older, especially beyond 35, and then even more precipitous drop after 40. So if that's the case for anybody, get a consult from a fertility specialist. Dr. Minto Bain is with Trinidad IVF, and I have volunteered and worked there like immediately after med school. She's very lovely, very wonderful, and she would be able to work you up, hopefully. There are people who have unexplained cases, but, a lot of times you can try and figure out what may be causing it, and also she can figure it out and provide treatment. So as I said, we have 2 options: IVF Trinidad or the Barbados clinic. I
Dr.
hope that.
Prasad, that's my private doctor.
Oh,
Yeah. He, well, I know someone who did IVF and she had recommended him. So, but I started to go with him in my first pregnancy, second pregnancy, and the third one. But I
and
didn't
then
go with him, but he's actually pretty good, pretty good. And now he has his own women's hospital in St. Augustine. So,
Sanjavini.
San Giovanni.
Sanjavani, okay.
Yeah. Yeah.
So I'm seeing another question here, but I mean, I honestly can't answer this other question. Is what happens happening to someone who bleeds dark brown 6 days after their period? It could just be the resolution of the period hasn't like quite finished. But to be honest, that is like more of a question that we'd have to like go way more into depth of what you mean and what you're experiencing. So I would just definitely advise that if you're getting any abnormal symptoms that you're not accustomed to after your period, to reach out to your gynecologist. You don't have to physically go in. You could just reach out, and especially during this time, and try to figure it out. You may need certain tests to be done, and yeah, certain personal questions we can't answer as medical doctors because it comes with like medical legal issues, but generalized questions I can definitely get to. So if anybody has general questions about anything, we can answer that. Is there anybody else asking anything?
What can
What
we do next time? Well, usually in my case, it usually goes back to normal, like 3 to 4 months after. Um, so I don't know if after that period it doesn't go back. I'm not sure what caused it.
It
But my
typically resolves if it's pregnant. If your question is pregnancy related, it's called melasma, and if it is pregnancy related, it will typically resolve as soon as your pregnancy hormone starts to decrease. So once the pregnancy is over, the pregnancy hormone starts to decrease, and that typically resolve. If you're just talking about that without pregnancy you have dark spots, a dark neck and underarms, then you would probably need to see your doctor, because it could be, even though obviously I can't say, um, something we call acanthosis nigricans, which is associated with insulin resistance. So, if we're talking outside of pregnancy, having discoloration like that, you definitely want to make sure that you don't have any signs of insulin resistance. But if you're talking about during pregnancy, immediately after pregnancy, then, it would usually resolve and give it time to resolve.
yeah.
Anybody else have any questions? Another thing that I know a lot of people don't talk about, being home all this time and being like home with significant others, is like for people who may be experiencing domestic violence.
Okay.
It's taboo to talk about, but there are a lot of people who experience domestic violence, and it is increased actually now because of coronavirus. Not that the virus is causing it, but the fact that everybody's home right now. So if the abusive person used to have an outlet by going with friends at the bar, but now they're home all the time, it increased. And I actually heard of a case quite recently, very, very tragic, of a young lady who lost her life because of domestic violence. He subsequently killed himself afterwards as well, and this happened last week.
That's really
Um,
good.
it didn't happen in Trinidad, but they are of Trinidad heritage. It happened in the States. Um, so there are hotlines to reach out to if you or someone you know is on experiencing domestic violence. So in the US, you can call 800-799-SAFE, or you can text "Love Is" to 22522. And in Trinidad, you can call 868-800-SAVE with a V, SAVE. So in the US, it's SAFE. In Trinidad, it's 868-800-SAVE. So it may not be something that everybody requires, but if you do, please utilize it, because no one should be subjected to domestic violence or partner abuse, or even if it's happening to the children, please reach out. Do you plan to breastfeed, Megan?
No, mom.
No?
I've had challenges with breastfeeding with the past 2 pregnancies.
Right.
Very painful, very uncomfortable, and my kids didn't latch properly, and I just didn't want the stress. But I pumped exclusively.
Okay,
Yeah.
that's good. So breastfed is the best, but I've actually altered that and changed that to fed is the best. We used to say breastfed is the best, and if you can breastfeed, that's excellent. If you have difficulty breastfeeding, then breast milk is the next best thing. And if you're having difficulty with that, then, I mean, getting the baby fed. However the baby is fed, fed is best. So I remember I used to always preach breast is best, and I still believe if you can, that is the best option. But I always have to bear in mind that not everyone could do it for different reasons. So,
Because remember, I
yep,
have the kids as well who are very young and needy, and it didn't work out for me the last time, and I didn't want to stress myself too much about it. I
right,
would attempt this time and see how it goes. I
right.
would give it the best shot, but if it doesn't work out, I'm not going to be talking about it. I will
You
feed
be
my child.
fed.
Yeah.
He will be fed, and that's the most important thing. And as it stands now, we have no evidence of coronavirus in breast milk. So that is
Ooh,
also good. Megan is obviously beyond her bedtime, people.
you can go ahead.
Her little daughter was up for like hours beyond the bed. The family whole tonight is like not doing best. Their bedtime. When I breastfed, I dropped the pregnancy weight so fast, and that's true. That does happen.
For you, Janet, okay? I'm happy for everybody who breastfeed and lost weight. I'm happy for all of you guys, okay? I have, it's a reality. It's you for me. That breastfeeding.
Whatever works for you to get your baby fed.
I agree.
Whatever works. So if no one else has any questions, I think I went through all my questions with Megan and then all the little tidbits that I wanted to share. So we can actually wrap this up for tonight. I am definitely going to take pictures and a video. If anyone actually did the looks with us today, I hope people did. And if anyone did it, please take pictures and send it to us, like tag us in it, send it in the DMs. Let us know that you did it. I really want to see the looks because I love this look. I'm learning so much new things every time I do a makeup session. I'm like, oh, I didn't know that. Yes. So thank you very much, Megan, for joining us. Or for me joining you, I actually joined you live, but for joining us here today and showing us this wonderful look, giving us your tips and beauty secrets. We have to do this again, and next time we're just using the iPad.
Really apologize to everyone for all the delays and hiccups and technical problems. I will work on my crappy phone. In the meantime, stay safe, stay home, flatten the curve. If you do have to go out, wear your mask. And yeah.
Oh, I forgot one last thing. Happy Mother's Day in advance to all the mothers out there. Whether you're already a mother, whether you're expecting, whether you're trying, whether you have futuristic goals, or whether you're like me, a godmom. Happy Mother's Day in advance. And thank you all for staying on with throughout all the glitches. We worked it out and we got this look done, okay? Have a good night.
Thank you so much, Janelle, for the opportunity to come on here and for us to share this life together. This was a first time experience for me, and I really enjoyed it. I will definitely be doing more of these again. We will have to do a do-over.
You have to do over.
Do-over. So, thanks again for having me join you. Is this your sister now?
This is my sister. This is Giselle, yes.
Hi, Jesse. Hi, Abby. So this is it. Bye, Emma. I am so tired. I don't want to sleep myself. I'm gonna try to take some pics before this makeup. I don't know if I'm taking it off. I will see how it goes. If
Don't
you
forget to save so I can steal.
yes, definitely. Well, have a
Thank you, everyone. Thank you.
Well, iPad on 4%. Ladies. Bye.
Bye-bye.